All right, thank you, Catherine. Well, joining us in studio is Jason and Lydia from the Finger Lakes VA healthcare system to talk about the PACT Act. So what is the PACT Act to start?
So the PACT Act is expansion of eligibility for VA healthcare and other benefits. The initial portion of it expanded the locations and dates associated with Vietnam service, and then added a number of service-connected conditions that are presumptive for both Southwest Asia and Southeast Asia. And now we have a new three-cohort expansion that adds more eligibility for Southwest Asia combat and recent combat, but also what's really exciting is it adds toxic exposure eligibility.
And Lydia, would you like to expand upon that, about
Sure.
this new expansion to the PACT Act?
Absolutely. So we're referring to Vietnam veterans, post 9/11 veterans, service members that were deployed, but also not just overseas, but veterans that experienced exposure stateside as well. So this expansion is the largest expansion in healthcare history.
Okay, and I guess how does the PACT Act expand on veterans' healthcare? How can this, really help them and get the help that they may need?
So it helps us get more folks eligible into the healthcare system, and what we're really excited about is this is an opportunity to readdress some folks that may have been turned down in the past. Maybe they were told they made too much money or didn't have other qualifying factors. Well, now with these toxic exposures, we hope that they'll come back, fill out another application, let us get them in there, and then we start administering healthcare. But it's so much more than that for us. We want to not just provide healthcare, we want to make veterans healthier, and we have a lot of programs to help once they're in.
And I think traditionally, when referring to the PACT Act that first came out a couple years ago, people really focused on the burn pits. But there are a lot more exposures, diesel fuels, asbestos, more than just the burn pits, sand, people, or different elements that veterans encounter during their active duty time.
Right, Agent Orange as well.
Absolutely.
Yep. Okay, well, I guess for vets who are eligible and meet these requirements, what do they need to do? How can they sign up? What are those steps that they need to go through?
So I would say don't think about whether or not you're eligible, come and apply. We always recommend that you come and visit us. Our enrollment and eligibility office is in Bath, but we have the website, we have the 800 number. They're available too, but if you come in and see us, we'll shake your hand and say, let us chart the best path towards eligibility.
Let us make it easy for you. Sometimes it can be a challenge navigating online systems. So that's why we're here. We're here to help you. We want to be that guiding hand to get you in the door and go through that process and make it as easy as possible. And a lot of our staff that work at the VA are veterans themselves. So it's veterans helping veterans.
Right, and I guess why should people pick the VA to kind of expand upon that? There might be a stigma or I don't want to go to the VA, but sometimes people just need help. So I guess why pick the VA?
So right now there's roughly a little over 6 million veterans that get their health care with VA, and we offer individualized but also comprehensive care. So we have primary care, we have maternal health, we have mental health care, we offer audiology and dental services. There's just a wide array of services that we offer. We also believe that we offer the best health care. So we have shorter wait times, better accessibility, and we all have a close personal connection with veterans, whether the employee is a veteran or family member is a veteran. We feel like we serve a greater purpose.
Right. All right. Well, I guess that will do it for us. Thank you so much, Jason and Lydia, for joining us.